All right, so today we're going to be discussing Idea R, and this is another small group teaching method specifically designed for the postgraduate learner and the postgraduate academic half day, for example. I will start with a disclosure that Idea R is pretty near and dear to my heart, as I was on the team that developed this. We developed it as an alternative to things like Jigsaw or Think, Pair, Share, especially in the busy postgraduate environment where you may not be able to reliably predict who is going to come to your half day. You know, things like post-call days, sick days, busy clinical services where trainees arrive late, and then busy clinical services where trainees might be paged out of your session as well. All of these things require some flexibility in the moment when you're conducting a half day. And if you have a rigid structure, you stand the risk of having your talk or your teaching session thrown off course. Some facilitators will tend more towards didactics to try and accommodate this, but IDR allows for some flexibility, and we're going to see how in a moment. So, I will fix this back up. I've run through this a couple times. So, you can see here that there's 5 different steps here, and there's a bit of a cycle, there's a bit of outlier there, and we'll go through these one by one. So the first step is individual answer. So again, we have our facilitator, we have our question or our case, our diagnostic dilemma, our management plan, whatever it is that you want the trainees to figure out. What you're going to ask them to do first is to commit to an answer. So give them 30 to 60 seconds, write down or type. I'm a big fan of having them put something down on a paper or on the laptop screen to actually make sure that they're thinking things through, right? You want them to commit to an answer. Then we have the discussion part, where we're going to divide the trainees up into little groups and ask them to come to a consensus with each other. So we're starting off easy. We've got 6 folks here, so 3 groups of 2, easy way to do it. Have them speak to each other for a couple minutes, come up with an answer. Next up is expanded discussion. So this is where the trainees have come up with an answer in their small group, and they're going to bring it back to the main group and present their answer. Opportunity for you as the facilitator to do a bit of back and forth, to ask questions, ask clarifying items, etc. And then we're going to go for advancement of the case. Whoops. So because this is postgraduate and, we really want to make this interactive, have a lot of real world learning and thinking, we're going to then maybe have a little bit of didactic, a little bit of explanation, but then change the case up. Maybe we change something in the case presentation itself, more comorbidities, older age, etc. Maybe we change from diagnosis to management. But in any case, we want to keep that small group feel, that interactive feel going. We want to continue to engage our learners. And again, we're going to start, that's why we have the cycle, work with individual answer, right? So asking the trainees, think, commit, what do you think is the answer to this dilemma we have? Now, what's happening while that's happening is that a straggler has come in, someone has arrived late. Now, don't worry about this, they can just jump in whenever they arrive. Because when we have our discussion section again, that's where the R comes in, this rearrangement, where we're not going to stick with the same groups, okay? When we divide the trainees up again, we're going to mix it up. So maybe you might go here, you're going to come here, and we'll swap these two. So now we have 2 groups of 2 and 1 group of 3. And that's perfectly okay, right? Because our goal here is to allow the trainees opportunities to work with and learn from different ones of their colleagues. Everyone's approaching this with different experiences, different backgrounds, etc., and giving them the opportunity to interact with a diverse group of their peers can be helpful for the learning, right? And there's different ways you could do this too. You could do a group of 3, a group of 4, kind of whatever works for you in your situation and in the moment. When we've run sessions using IdeaR, usually we'll have maybe 2 or 3 main cases with 2 or 3 parts each. So running through this cycle quite a few times. You can give the trainees pre-reading. I find that can be very helpful, but not necessarily assigning specific pre-reading to specific trainees as you might do with the Jigsaw method. So in a nutshell, that's IDR. Hopefully that gives you something to think about if you're doing postgraduate teaching and for half days in the future.